right? Everybody here, I'm assuming, is from this gym at this point, right? So it's important when we're in a CrossFit space to make sure that we've got not just plenty of range of motion, right, but also plenty of strength when we're trying to do movements that require us to be in an overhead position. And so for us at Rcvr, part of our goal when we're working with folks is to make sure that you're not just like having healthy shoulders for your daily lives, right? But we want you to be able to do the things that you can do in the gym. And so that's part of what sets us apart in what we do as physical therapists. So our clinic, Rcvr, is a performance-based clinic where our goal is to make sure that we're taking people beyond whatever their baseline was, right? When somebody comes into us with an injury, with an issue, often if you go to a typical PT clinic, they're trying to get you back to like wherever you were before, right? Making sure you can like take your milk in and out of your fridge. That's cool, that's great. We want you to be able to do that too. But we also understand as providers that the demands of what you're doing in here, the demands of your life outside here might look different than the typical person's, right? So we are a blend of chiropractic and physical therapy care. So Dr. Shea, Dr. Madison, we are both physical therapists, and then some of you might also know Dr. Keegan Metcalf. He is a chiropractor. We get a lot of questions like, okay, but like chiropractic, PT, like how does that work? And for us, we really treat very, very similar. If you were to come see me and then to go see Keegan, what you would find is that the way that we're practicing is pretty interchangeable. If you need some sort of soft tissue mobilization, something to like bring down your pain level, we're gonna start with that at the beginning of the session, and then we're gonna get you out into the gym and get you moving. So there's no like quick pop, send you out the door and on your way with Keegan, just like we're not just going to cup you and let you leave the clinic, right? Or just, you know, send you out to the gym without making sure that those tissues are ready to be loaded. So for us, like our standard of care is all very, very similar, and we're making sure that our goal is to try to get you back to better than where you were before we see us. So I'm gonna let Shay give like, do you want to give like a little intro? Like,
yeah, just a little background. Keegan and I worked together at a previous clinic and really just hit it off. We practiced the same way. We had a lot of the same beliefs as far as like not only patient care, but beliefs on like how we take care of our own bodies. You can see us working out in the gym, taking care of ourselves, trying to eat healthy, all the things. And so when you align with someone so much like that, you're like, okay, we got to open a clinic. We got to like serve this population the best way we can, especially in this area of the country, right, where there's so many people that are unhealthy. So we founded Rcvr in 2023. We sat at a coffee shop for probably 3 hours trying to figure out like, one, a name that wasn't taken or trademarked. Two, we took out the vowels. No, this doesn't stand for anything for Rcvr. It's Rcvr. So it's just Rcvr without the vowels. That can be a little confusing for people. So yeah, like I think Madison did a beautiful job covering standard of care. Little background on me, I got my bachelor's from OU, so in health and exercise science. I was down there for 4 years. And then I went to Mayo Clinic for PT school up in Rochester, Minnesota, and then froze my ass off and moved back home. So here I am. But that's kind of my background. I am specialized in orthopedic, sports, and pelvic health. So I see a lot of pregnancy postpartum. I would say that's about 75% of my caseload, but I do love my cranky shoulder, my low backs, my knees, you know, et cetera. And I do see folks for that as well. Yeah, that's a background on me. I teach in the pelvic health space for a group called Institute of Clinical Excellence. Madison also teaches for them. I'll let her give her a little background on that, but I'm teaching other providers in the pregnancy postpartum space how to treat like I treat in the gym, getting people active, making sure that our postpartum moms, whether that's 6 months postpartum or 6 years postpartum, are active and living their best lives. So, little thing about how I'm passionate about that population.
my path to PT was a little bit untraditional, so I started in a different graduate program. So I was in the research space. I did a PhD in neurobiology before I decided I wanted to transition over to a DPT where I could like practice and work hands-on with patients. And so part of my background was seeing like what the research says and how that's not being applied in practice in the way that we would hope it would be in the physical therapy space. And so Shay mentioned teaching for Institute of Clinical Excellence. I'm in their fitness athlete division, and our goal is to make sure that we're helping PTs help other PTs load their patients in a way that's actually like appropriate and effective and is going to create long-term change in those tissues. And so when we talk about like a different standard of care, when we say different, what we really mean is better, right? Like we are trying to make sure that we're moving beyond like PT 1.0, where they're going to write you a standard prescription, you're going to be here 3 times a week for the next 12 weeks, and you're never really going to get any better because they're never really going to look into your tissues, right? So obviously, like when somebody has issue, injury, whatever, like we want to see them in the clinic, and we want to make sure that we're providing you with some sort of plan of care that's individualized to you and whatever your limitation, injury, issue is. But also we want to make sure that we understand that like cash pay PT is a premium price. You're getting a premium service when you come to see us, right? But we also want to be out in the community making sure that we're providing resources like this to keep you guys moving in a general basis, right? So these are some of the things that we see from like a shoulder overhead perspective that can be really helpful for like a broad swath of people, but just know that you are an individual human, right? And so what you have going on might not necessarily like fit exactly in one of these boxes. And if you feel like that's the case, like come talk to us. We would love to like help you a little bit more specifically. But to give you kind of a roadmap of like where we plan to take things today, we're gonna start with some of the typical limiters for an overhead position. Going to be a little bit surprising to some of you, maybe not to others, but like we're going to kind of do like a brief overview from the ground up. So we'll, like, I'm sure this is shocking to no one who's ever watched somebody overhead squat before. If your ankles are tight, that's going to make a difference, right? So we're going to talk a little bit, not just about your shoulders, but about some of those other areas in the chain that might make a difference. We're also going to talk, how are you assessing these things? So if you're like, man, I know my overhead squat is bad, but I'm not really sure where things are breaking down. Like, how can you kind of take a joint by joint look at what might be actually specifically limiting to you? And then we wouldn't really be helpful if we were like, this is your problem, peace out, we're gone, right? Like we want to give you some drills and some things that you can take away from this, that you can try in your warm-ups, that you can try to add into accessory programs that are really going to help you actually like take something from this to be able to use and make your workouts a little bit better. And then we're gonna wrap it up. Like, we wanna make sure that we're not just sitting here, like, nobody comes to a workshop like this in CrossFit gym so I can sit here and like, your girl can yap. Like, could I yap at you for like 3 hours with you sitting there? Absolutely. But that's no problem. We wanna make sure we're getting moving. Beth is laughing, she knows it's true. Stand up here, give me a mic, let me up. So, some of the areas that we see are often limiting folks in terms of their overhead performance: ankle and hip, mid-back, and shoulder. We're going to spend most of our time today talking about those other two boxes, mid-back and shoulder. So those are the two that if we can make some differences there, we're probably going to get you the quickest level of change to impact what you're actually seeing in terms of that like overhead performance and position. But we also don't want to just gloss over the fact that your ankle and hip might be an issue as well. Sometimes we see folks that are coming into the clinic and they're overhead squatting. Will you give me like a weird type of position? So they look like this, and they come in. This is a person who's gonna come tell me, dog, my shoulder really hurts. And I'm like, yeah, that makes sense, right? Ouch. But if we look at what's happening here, right, those knees are not getting over those toes at all, right? So what we're having to do at that point is really pull that barbell back behind our head to try to maintain some sort of sense of stability over that midfoot, right? Shoulder feels like crap, but where that limitation is actually coming from is from the ankle. So if Shay drives that ankle forward over her knee, drops that butt between her feet, all of a sudden we can get those shoulders in a little bit better position, right? So that might be a human that's coming to me and they're like, man, I feel like I don't have any shoulder mobility at all, it really hurts. And I'm watching that squat pattern and thinking, it's probably not just the shoulder, right? It's probably something that we need to address lower down the chain. Either with just coaching and cueing, hey, sit your butt between your feet, right? Instead of reaching that butt back. Or it might be like, we have a truly stiff joint that we want to start trying to work on, or raising those heels, right? So that's, I think, another area where we can really kind of draw attention to the fact that if the provider that you're seeing is never watching you move, like if you just go in and say, hey, my shoulder hurts with overhead squats, one, if they say what's an overhead squat, that's a problem. But two, if they're never watching you overhead squat, it's going to be really, really hard for them to get a really, really good idea of exactly what's causing those issues. So like, make sure your provider, like make them watch you squat, right? Make them help you in that respect as well. Or just come to us.
And if they don't know how to coach an overhead squat,
that's the problem.
They might not pick up on an ankle problem.
So we're not going to spend a ton of time like assessing, addressing, and things that are coming from the ankles today. We do like ankle squat workshops as well. But a couple things that I'll draw your attention to is if you're somebody that you're like already know, yeah, I have a really stiff ankle, right? where you're feeling that tension becomes important. So if I've got somebody that's like, yeah, it's right here at the front, I feel like I really get a lot of pressure there when I try to get my knee over the toe, that's somebody that I'm looking at and assuming that we probably have some stiffness in the joint itself, right? Like the way that those bones are meeting one another, we don't have quite enough room to really get the top of that foot through that shin. So that's somebody that's gonna benefit from like a true like ankle mobility drill, right? Or elevating your heels, also do that, and non-dorm. If they have tension along the back side of that calf, that tells me more like we probably need some stretching and loading through that calf, right? So there are a lot of different ways that we can address that. But in general, our goal with the ankle is to make sure that we're figuring out where exactly that tension is coming from. Could be one, could be the other, could be both, right? And then making sure that we've got the strength, stability, and the mobility necessary for that ankle to get in a good position for you to keep that chest upright as well.
Can I add to that now?
Yes, please.
What's the vibe in here on lifters, heel lifts, things like that? Like, I go to a lot of gyms and people are like, okay, I wear these barefoot shoes, or I only squat barefoot, or whatever. And I am 100% okay with that. If you have the mobility, right? But if you are diehard in the camp of I've got to squat barefoot and you look like what I just looked like, that's a problem because we're causing other issues. And if we're not addressing that ankle mobility and then helping yourself during sport, during your squats, during your metcons, whatever, you're actually probably causing more problems. So nobody's ever told a soccer player, like, you know what, don't play with shin guards. We're not gonna use those. We shouldn't be telling CrossFitters, weightlifters, etc., don't wear lifters. That's really ignorant. So it's not a cheat code, it's an advantage that is putting you in optimal positions. No other sport doesn't wear the equipment for their sport. Why would we tell CrossFitters and weightlifters that, right? Cool.
Love it. And not ortho. So we can also have some limitations with the hip. This one can often come from issues with that range of motion. So particularly we see with like an internal rotation position. I'm gonna have Shay. She's gonna go knee up here. A little bit of confusing because the foot is going out, right? But that's internal rotation. Okay. So when we're coaching squats, we talk a lot about like, hey, I want you to drive your knees out, right? So we really think about squats as being like a super external rotation heavy movement. And it's true, right? I definitely want to make sure that as we're coming down to the bottom of the squat, we're maintaining control, we're maintaining a solid knee drive out. As we come up though, relative to the pelvis, that hip is internally rotated, right? We might not be visually seeing that, but that's what's happening. So if you have a limitation in that internal rotation position, it's gonna feel like crap when you try to get out of the water, right? It's gonna feel really grindy, it's gonna feel a little bit pitchy, and that's often one of the things that I have folks telling me, like, hey, I've got a pinch at the front of my squat. That's one of the things that I'm looking for, right? So could be an issue with that range of motion of the joint. It could also be a strength issue, right? This is where, and I'm not talking about, will you give me like a adductor width on the way up? I'm not talking about knee drive as great on the way down and we get a little bit of a pop into the knees on the way up. That's Shay's adductor on the inside of that hip, helping to extend her hip. I'm cool with that, right? What I don't want is like, we've all watched like the weight room videos of like the 14, 15, 16-year-old Aiden, Braden, Caden with the permed hair where they get a barbell on their back and they're like this. That is what I'm talking about, right? Like, we've all seen that, right? The videos where you're like, oh my God, please go to a CrossFit gym and let someone coach you because that's horrifying. That is an external stability issue, right? At that point, it's not that we're like, our adductors are like doing something, it's that they're not doing anything, the outside of the hip isn't doing anything. We don't have the external strength and stability to keep that strong drive out when we control the descent of the squat, right? So, a couple of different places that things can break down here too. That's where their power clean that looks like this becomes like an overhead squat that you're like very concerned that they're gonna drop the bar, right? So, ankle can make a difference, hip can make a difference, but what we wanna focus on for you guys today, where people often have the most complaint with that overhead mobility, is their mid-back and their shoulder. So that complex is super, super interconnected. If I have somebody coming to me with shoulder pain, I'm also looking at their mid-back. I'm also looking at their neck. That's a whole other conversation as well. But when we think about different issues that somebody could be experiencing at the shoulder, we're typically in clinic looking for people to fall into a couple of different buckets. Sometimes it's a stiff shoulder, right? this is your guy who's like super, super buff and like his range of motion looks like this. And I try to like take him further and it's like a hard stomp, right? You're like,
his
oh.
front rack looks like this.
Oh.
If you need an example,
He's like this. We've all seen that. And you're like, okay, can you go further? And he's like, this is it. This is all I've got. Like, that's a stiff shoulder, right? Could be stiffness that's coming from like, again, we've got like our super buff dudes, like lots of muscular restriction. Could be a restriction at the joint itself as well. Or we're looking for like a weak, we don't like the term unstable, right? Because that can be, if I tell you your shoulder's unstable, that's scary, right? And I don't want you to be scared of your shoulder, right? It needs a little bit more stability, it needs a little bit more strength. We've got a little bit of weakness in that joint. Those are things that we can address, right? Those are things that it's our goal to provide you with some tools to solve those issues. How we address them is sometimes different, but what you're gonna find as we go across, like even if the guiding principles change a little bit, ultimately what we're trying to do is to, I don't love this term either, but like bulletproof your shoulder, right? If we've got some sort of stiffness, true stiffness, we're trying to open up that joint more, we're trying to get you more range of motion, and then we're trying to increase the strength within that new range that we've opened up. If you've got a lot of range of motion, more than you need, perhaps, hi, it's me, like my shoulders should not be able to go back behind my head that far, right? I'm still trying to strengthen you in the range that you have, right? So strength, stability, making sure that you've got a shoulder complex that can not only get into the position overhead that you need, but also like maintain that position throughout your full range of motion. So when we're looking at overhead position and thinking about that mid-back as kind of like that central starting point, again, we can have a stiff mid-back or we can have a weak mid-back. So we're looking for folks when they come in, or when we're coaching, right? Shay and I both coach as well. We're looking for, is this a person who like can't get their back into an extended position? I'm gonna show, I'm gonna have you. So extension here through the mid-back looks like this, right? So this is where you're, again, we're thinking about front rack, go thumbs here for me. We've got the guy who, when he goes to front rack, sticks that butt out instead, right? Because we don't have the range here we need to tuck those hips and extend here, right? It's that chest up position, right? We think about the bottom of a clean, somebody receives a clean and they're like this. And you're like, get your elbows up, and they're like, I'm trying. And this is all we've got, right? So that's a lack of extension. So that's it, I love that, right?
You have somebody in class that
Everything we talked about. It runs in the family.
So if we don't have extension through that mid-back, we might be using that shoulder to kind of try to make up for that position, right? Alternatively, if we have like the extension position, but we don't have the strength, we're still gonna find ourselves in that same spot, right? So just like when we're talking about making sure that we've got full range of motion in a squat, and we need the strength to then drive out of the bottom, it's the same for that mid-back, right? I need you to be able to get into an open chest position, but I also need you to have the strength to maintain that position when we've got a heavy barbell in front rack. So from there, thinking about how this relates to the shoulder, right? Again, if I don't have the motion at the mid-back, that shoulder might take up the slack a little bit. Or if I don't have range of motion at the shoulder, that mid-back might have to do a little bit more work to try and engineer an overhead position. Now imagine for me for just a second that we've got a stiff or weak shoulder and we've got a stiff or weak mid-back, and we're trying to get overhead. If I go through my low back, all of a sudden that dumbbell is up overhead, right? So if we think about like our open workouts, our open standard, where goal, like think about like, love the laughing this.
Thrusters?
People are like, yeah. We're thinking about thruster, right? If I don't have good strength of motion overhead, but I got a lot of mobility in my mid-back, or my low back, and I do, right? I can go from here to get that stacked position that I'm gonna need for my judge to be like, yeah, that's a good rep. It might count, but your back's gonna feel like crap tomorrow, right? Yep. So just an example of like how issues with that overhead position can impact anywhere else down the chain, right? So, do you have the requisite range of motion, right? Do you have a stiff shoulder? If you do, right, can we get you into a more overhead position or a more open position? Can we strengthen you in that position? If you've got the range of motion, but it's weak, can we strengthen you so that you can maintain that position without losing positioning elsewhere down the chain? So I do want to hit just briefly how this relates to breathing and bracing. So we do like a whole breathing and bracing workshop as well. Often when we start talking about overhead position, some of the questions that we get, particularly from a overhead squat, that's the thing that we seem to, when we talk about shoulders, when we talk about overhead, that's the movement that we get the most questions about, right? Which makes a lot of sense. It's one of the most demanding in terms of overhead as it relates to literally everywhere else down the chain, right? So part of the issue that we sometimes see is like, okay, I get overhead, but now how do I breathe throughout that motion, right? Or where should my ribs be in relation to everything else? So I'm gonna let Shay demo here, overhead position with, that's perfect, yeah. With stacked rib, right? So we've got pointy part of her rib, pointy part of her hip. They're crunched together.
A little bit.
I sure can. We'll just do a couple little motions here, right? So she's stacked, ribs are over her hips, right? So if we think about breathing and bracing from this position, she's in a good spot to really like inflate that core canister, get a big squeeze, and maintain that position throughout her range of motion. She can squat down here, that's not gonna move, right? If we start to lose this stacked position, right? If we have some sort of, again, limitation overhead, and we've got to start getting a bigger arch through that low back, what we're getting is that rib and that hip opening up, right? It's really, really, really hard to brace from this position. So, she said, yeah. So, all of this to say, right? Sometimes the piece that's helpful for people, like, is drawing attention to this, drawing attention to that brace, right? If you are somebody who tends to be a little bit more mobile, like Shay and I are really good examples of that, it's really easy for us to like hang out on those ligaments. I could overhead squat like this all day long, right? My back would feel like crap tomorrow, my hips would feel like crap tomorrow. But I could do it because that's a really easy position for me to just kind of hang out on those joints passively, right? Like,
Okay, I know she did it from the front. Can she do it from the side?
yeah, for sure.
Also, side note, pelvic plug, if you're squatting like that, you'll probably pee your pants. Or fart, yeah. So you can see my ribs.
Yeah.
So this is bad.
Yep.
That's
I can
not,
get there.
That's not a brace
Yeah.
forward just because I can walk out, right? It is not a posterior pelvic tilt. Nobody can squat like this. It is a stacked.
Hips and knees are breaking at the same time, butt goes back, knees go down, butt right between your feet. Good. So, often for people, right, particularly if we have mobility, right, sometimes like it's not just about the strength and not just about the range of motion. It's just kind of getting some awareness for where your body's at in space, right? That's one of those things that if we can draw attention to that, like, hey, your bowls are open, right? If I think about top of my rib cage or bottom of my rib cage, top of my pelvis is two bowls, right? If I tell people I want your bowls to be stacked, not overlapped, that's that posterior tilt, right? Not open, that's that extra arch, but stacked on top of one another, right? Drawing awareness to that position often will bring people from here to here, right? So that's another one of those examples of how like coaching cueing movement can be a really, really good starting point for addressing issues with some of those positional things, right? Yes, we're PTs. Yes, we want to strengthen. Yes, we want to open your range of motion. But we wouldn't be doing our jobs if we didn't try coaching and cueing first. Ooh, love it. So, when we think about overhead movements, where all of these things come into play, that overhead squat is a big one. Now, dumbbell overhead squats are just rude. Like a lot of people get really mad when I use this example because they're like, what do you mean? I have to. That's my party trick. We have the group that we teach with, like, always ask what we want to see in the open. And I'm like, single arm dumbbell overhead squat. And they're like, it's never going to happen. I'm like, I know, but I wish it would.
And mine would be bench press.
Also,
Jacks row. Here we are. Never gonna happen.
So whether it's dumbbell single overhead or Or barbell overhead squat, that's the one that we're typically gonna see a lot more of, right? This is where all of those different pieces, ankle, hip, mid-back, shoulder, that we talked about really start to come into play. If you have a limitation at the ankle, you're gonna see an issue with that overhead squat. If you have a limitation at the hip, mid-back, shoulder, all of those things start to become important when we're thinking about maintaining a barbell position overhead and also dropping our butt between our feet. So, all of that's great, right? I think we all kind of understand the importance of having requisite mobility, having requisite strength when it comes to CrossFit and our barbell movements. But like, okay, cool, I get it, it's important, I already knew that. How are we gonna address things? How do we assess where you might have an individual limitation? And so, we're gonna go ahead and like find some space. We're gonna break through these as a group, right? So Shay and I are gonna go through mid-back. We're gonna go through a couple of different things through the shoulder, and then we're gonna let you guys have the opportunity to kind of test and play around on each other while we're moving around and helping.
You get to judge your friends. It's open season.
It's so fun.
That's every day.
Love that. So, the first one, I'm just gonna have you guys hang out where you're at. I'm gonna show you the first one on Shay here.
Stand up and stuff if you can't see.
Yeah. So, we're gonna put her in what we call a lumbar lock position. The goal with this assessment is to make sure I'm actually looking at her mid-back and not her low back. If you're a bendy girl, you can really, really cheat on this test and be like, yeah, I'm great, I got this. When really the rotation's coming from your low back instead of your mid-back. So she's gonna get into almost like a child's pose. So she's got her butt down on her feet. She's got one elbow tucked between her knees here. This butt on foot position is important. Now, if you've got big calves, like there's only so much you can do if you've got a little tissue restriction here, right? But if I see you like this, and then you go to test, and you're like this, that's what we're gonna call you on, right? So keep that butt down as much as your range of motion allows. You're gonna take one arm, we're gonna put it on our butt, and we're gonna ask Shay here, I'm gonna block this shoulder, I'm gonna say, hey, twist up toward the ceiling for me. Mobile girl. Now show me what it would look like if you didn't have extra flexibility. Yeah, she's a little stuck there, right? And so you can come in with your partners, and what I'm trying to assess here is this like a true stiffness? This is the guy that I probably can guess by looking's pretty stiff, and I come in and I'm like, oh yeah, that's a hard stop, right? I'm not getting any extra motion from this person. Or it might be like she gets there, that's as much as she's got actively, and I come in and I yank her, whoo, next to up there. I yank her all the way to the ceiling, right? That's telling me one is stiff, right? Not only does she not have the range of motion to get there actively, but I can't get her there, right? That joint, those muscles are saying, no, this is a hard stop. Or it's that she doesn't have the strength to actively pull herself all the way into that range of motion.
And then I can reach it. So that's a weakness problem.
Yeah. So it might be too that you've got somebody that you're like, they roll all the way here and they can hold it for about 2 seconds before they drop back down, right?
Or they get it right.
That happens a lot too. Those are all things that are telling me we need a little bit more strength and control through that motion. So let's go ahead, break out with our partners. We're gonna take partners, groups of 3, groups of 4, whatever. Judge each other. Judge each other. It's open season.
Okay.
Can we get like a little...
Lucas.
What if you were stiff? Anybody stiff? Some stiff? Yeah. There's usually a pretty good mix of folks. If you were like, I had nothing, mine was perfect, I'm here to tell you, if we load you under a heavy barbell, we might start to see some things appear, right? Like, this is my person that they're like, I have issues with my front rack, but it only crops up at like 89% of my one rep max. And that's where we get where they go to receive, it looks really good, and they get to the bottom, they look like this, right? That's still a weakness in your mid-back and in your front rack position. It just means that it's not happening until things start to get heavy. And the way that we address that is going to look a little bit different, right? For the most part, though, depending on what you saw, we have some drills that we'll chat that are used to kind of open up or strengthen that mid-back position. Typically, we're trying to do a little bit of both, right? I'm trying to get you into the position that I want you to be in, whether it's stiff, whether you don't typically have the strength to get there, and then I'm trying to make you stronger after you do. So for our shoulders, one of the most common issues that I see with people in the CrossFit space is that limitation in that flexion position straight out in front. So this could be coming from the capsule itself, right? That's that stiff joint where we're like, yeah, I get here, don't have anything else. It's because that the basically ball and socket that's in there is a little bit tighter than we would potentially want it to be. Or it could be a limitation in the muscles that are surrounding the joint. So Shay is such a great example of a really, go up overhead for me, like juicy lat. I hate that I said that, I'm kind of grossed out. But I needled Shay's lat recently. There's a lot of muscle mass there. Now, because her shoulder is as mobile as it is, that doesn't become limiting to her at all, right?
So the guy that's like, I'm just too jacked, that's not a thing.
But it is one of the things that I'm looking for when somebody can't get straight up overhead. So you'll see Shay, that's a really good overhead position, right? If I needled her lat or I poked around on her lat for a while, I'm here to tell you, having assessed her before, that I could get quite a few more degrees out of that shoulder, right? So one of the common muscles that we're going to see limiting. Other one is subscap, which is in that armpit. Yeah, everybody makes that face when I start poking in that armpit. So when we're assessing in clinic, we're trying to decide, is this somebody that has a stiff capsule? Is this somebody that has stiff muscle surrounding the capsule? Or is it somebody that might have a little bit of both? And so when I'm looking for that shoulder flexion position limitations, there's a couple different ways that we can do this. I'm typically going to assess on the table, right? Because I want to know what somebody looks like with a little bit of gravity on board. But an easy way to test this in the gym, in clinic, particularly when we're trying to decide if those lats are involved, is putting somebody at the wall. So she's crisscross applesauce here. If you're like, haha, joke's on you, I can't even get into that position. You can go feet out out a little bit further, that's just fine. The main thing that I want to see with that seated position is that she's got her back flush up against that wall. So just like we demoed in our little lecture portion here, she could really arch her back off that wall and engineer a little bit more overhead shoulder flexion, right? That isn't, at this point, assessing her shoulders. It's assessing how much stretch she can get through that back, right? So she's gonna keep that back flush. She's gonna go hands on her knees. That's a really easy way to make sure you're assessing from the same place every time. If I have somebody that I'm looking for something really specific, like if you're like, this issue only shows up when I snatch, I'll have somebody get their snatch grip. It only shows up when I do bar muscle ups, I'll have them get their bar muscle up grip. But either way, we want to make sure that we're testing from the same place. Hands on knees is an easy way to do that. And from here, she's going to keep that back up against the wall. She's going to try to press those hands in. Beautiful. That's a great overhead position. She's a really mobile girl. It does not look like that often with people. Is there anybody that knows that they have a stiff shoulder that wants to embarrass themselves a little bit?
Coming at you, friend.
We're gonna get up against that wall here.
It's just so cool.
He's gonna get nice and flat. He's got hands right on those knees, and he's just gonna not hit me with that PVC. He's gonna reach right up overhead. Oofta! So in clinic, I'm assessing typically like, okay, how far away from the wall are we getting? You can relax. And I'm trying to see if we can make a change in session typically, right? So we might try some soft tissue stuff to see if we can loosen up that position. If you ever had a needle in your lap, it's terrible and amazing all at the same time. If we can engineer a little bit better overhead position, then from there, what I want to do is make sure that we're working on strengthening that range that we have to try and keep it. What we know from an abundance of research at this point is like, I can have you static stretch all the live long day, and that's probably not gonna make a long-term change in the flexibility of your muscle, in the mobility that you have in the joint, right? What we want to do, particularly if it's a muscular restriction, is strengthen it or get an eccentric lengthening, so that's when that muscle gets longer. Like when I come down here, right, my hamstrings are getting longer, right? That's a great way to increase hamstring flexibility, right? A nice, slow Romanian deadlift from getting a big, long stretch and a quick drive up, or slow, lowering of that lat, quick drive up. Those are the things that are gonna make long-term changes in the length of your muscles, right? If you feel like you're tight, if you feel like you're restricted, I don't need you to spend 17 hours of your day stretching. I need you to load the joint in an eccentric position. So we're gonna give you some tools for that too.
I'm gonna add to that. I don't have a problem with like go wad or primal mobility or any of those things. I'm not gonna hate on that. There's a time and a place for that. But it's also really good for the central nervous system. If
1000%.
you are living your life up here and you have a really stressful job and you have 75 kids and you have 4 dogs and like absolutely go wad, primal mobility, like those things are great because it brings that central nervous system down for 5 minutes a day of just you time. Love that. And it might feel pretty good afterward. But if go wad or primal mobility is not fixing your shoulder pain, there's a reason. A long sustained stretch is not going to fix your shoulder mobility. It's not going to fix your hip mobility. We have to load that tissue. So I'm not hating on those programs by any stretch of the imagination, and I think they're great. But it's more specific than that. And that's why a general program isn't going to work for people's pain and discomfort.
And that's not in any way to say that I'm also not prescribing like joint mobility work for people. Even my more mobile people, which sometimes seems counterintuitive, right? There is a time and a place. It should be applied specifically for you. Make sense? Good stuff. Thank you for being a demo. That was great. Sometimes it's real. Sometimes I just pick somebody that I saw earlier and I'm like, yeah. and that's really dejecting. So I always love when we've got a volunteer that's willing to jump in. So the other issue with the shoulder that we often see that can be really limiting, particularly in that front rack position, but also when we start talking overhead for a snatch or for an overhead squat, is external rotation. So there are a couple of different ways that we can assess this. And again, for you as a CrossFit athlete, as a provider, I'm definitely going to assess them in more than one position, right? Like you'll often see external rotation here, which is cool. I do that too, particularly if I have somebody that's like post-op shoulder or something like that. But like this, like not the most functional for you. What are you doing like this in CrossFit?
Can I have pizza?
Waiter, are you a waiter? Cool, love that, right? But for you, like we should in overhead positions, right? So either from here, right, can we get enough external rotation to then press up overhead and maintain that in a snatch, or here for front rack, right? So when we're talking about this overhead workshop, I can't help myself. When we're talking like a front rack position, right, particularly my guys, if we got a lot of bicep, I'm never gonna get my thumbs to my, well, I mean, I can because I don't have big biceps, but like, it's gonna be hard for some people to get their thumbs to their shoulders if we're thinking about a front rack, right? So the load then becomes like a wrist issue, right? I have to really crank my wrist back to get contact at the shoulders. Or we have enough shoulder external rotation that we can sit hands outside the shoulders for a little bit more active front rack, right? So becomes important for front rack, becomes even more important for a barbell in this position, right? If I'm really shoulders here when I try to overhead squat, it hurts, right? I have so much mobility too, so I can really demo this. My shoulders are gonna hurt later though. This, ouchie, 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 right? We wanna be able to really think about, it's that armpits forward position, but I have to be able to maintain that all the way down. Sometimes people start out great, and then as they come down, it kind of looks like this, and then they crank it back, and they go again.
You've all seen it.
Yeah, we all know that, right? And it's okay if that's like if you're sitting out there and you're like, that's me. That's okay, right? That's what we're here for. These ranges of motion, particularly like if you didn't do any sort of overhead sport at any point, right? Like how often are we strengthening external rotation in our daily lives if we're not CrossFitters? You're not, right? And so that's again another one of those areas where it's really hard to understand the demands of an overhead position if you've never been overhead. So keep that in mind, like from a provider standpoint. If you're like, I tried PT, it sucked, yeah, it might if you don't understand what you need to actually be able to get and maintain this position with the barbell. So, with our friends here, let's go ahead and take a look at that external rotation in a front rack position. So we've got Shay's elbow stacked in front of her shoulder. We're seeing if we can get wrist outside of elbow here. We're also looking in a field goal position. Can we get here? If you see this and people automatically drift forward, that's telling in and of itself, right? Can they maintain that and come back here?
We don't want to see shoulder dump either, like forward. That
Keep elbow stacked, either elbow stacked out to the side or elbow stacked down front. We're looking for that wrist outside that elbow. And again, we're using like a little bit more specific techniques in clinic, but we want to make sure that you guys have something that you can look at here, right? It's also important to keep in mind that some of these things are going to change from day to day, right? If I have a really cranky shoulder today, believe it or not, I have way more external rotation than this usually. This is a little bit of a limitation for me too. So if you're like, yeah, shoulder feels kind of crappy today, like what do we got going on? And you're looking, you're like, oh no, like usually I'm here and now I'm here. That tells you where you can kind of focus your warm-up a little bit. Okay, so break out with your friends. Let's take a look here. We're gonna do that external rotation. We're also gonna grab a PVC pipe. So we're going through both of our shoulder mobility issues. Oh, that's a lot. Do both arms, get both arms. Lift it. Is something broken? And do you have like a sense of compression? For just about everything else, like I have tremendous space. I have a tremendous space. There's a really great study done recently. Of the 100 people that they put in the MRI machine looking at rotator cuffs, 95 of them, 95 out of 100 guys, 95 of them had some sort of pathology. Very, very few of them had symptoms. 5 of them were quote unquote normal. So I would ask you, like, if only 5 of that sample of 100 people had a normal shoulder, is that really normal? No! We are humans who use our bodies on a regular basis. Like, most of us, I would guess, have been alive for anywhere from like 25 years and beyond, right? Like, your body shows that you live life, and I am like willing to put money down that every single one of you, if I put you on an MRI machine, it's going to tell you that there's something wrong with your shoulder. Probably all of them, right? I don't care, right? What I want to make sure is that as a provider, I'm addressing your pain, right? Like, I'm addressing the functional issues that you have. Hey, I have pain when I turn over and barbell steps. Cool, let's fix that. Hey, I have pain when I sleep at night. Great. Let's address your pain at night. For the love of God, don't get a surgery that your doctor's going to tell you that you can't move for 6 weeks. When at this point, all you can do is like, why?
That's our right.
I feel like this is a very pointed. Yes, right? I don't care. What we know is that if I have loaned you effectively, right? That's our job. Like, and to be like quite frank, if you're in a cash pay clinic, like the impetus to be good at your job is a lot higher. Because nobody's gonna come pay to see you at cash pay prices if you don't address their pain, right? So what I want people to take away from that is not like, I don't care what your name is, even though I kind of know. I want to make sure that what I care about is that you have pain. What I care about is that there are things that you can't do. And we're going to address those whether or not your impetus shows some sort of pathology. I've had people, I had a really, really great example, weightlifters that I worked with when I was in mission, who had, I mean, one of the worst cases of shoulder pain that I've ever, like, couldn't raise her arms. She went from, like, she was a state champion weightlifter. Like, she was, like, no explanation for really, like, this kind of crying, this onset, had some lifestyle things going on. She finally went and she's like, I just need to know. Like, told her, hey, we don't really think it's for your brain, and you just did that like that. Her image didn't show anything, which one in and of itself is crazy. Like, for her to be as active as she is, she's like one of those guys, right? We're talking 5%. Wild, right? Nothing was showing up on her image, and she still had pain. So what we did was continue what we were doing, and we addressed her pain, and it got better, right? So like, whether or not there's something on your image is less concerning to me than what that pain is keeping you from doing.
And on top of that, a lot of the people that come in our clinic, like, I have a lot of people on like a maintenance schedule at this point from like how often I see people. I do see people when they have like an acute like pain, something flaring up, and Madison's seeing a lot more of that right now than I am. But I have people that come in once a month and they're like, Shay, I didn't get more muscle up in this open, and like I really feel like I have the strength to do it. And I'm like, yeah, because your mobility sucks ass, right? So we address mobility. By the next open, then you can probably get a bar muscle up. So like, even if it's not limiting you from a pain perspective, there's some really, really cool things you can do in the gym if you move more optimally. So that enough should be like really fun and motivating.
And that is, I think, a good point for, again, another way that what we do is different, right? Like, insurance isn't going to pay for you to get more muscle up.
Right.
And so, like, what I'm getting at with that, though, is like, it's not just about the muscle up, right? Like, if you're like, hey, I feel like I've got some shoulder weakness, like, I may not have pain, but I have some sort of limitation. I want to keep doing what I'm doing here. That's performance goal, right? That's a longevity goal. That's something that we're talking about really glad that I know it's a little bit of like but there's very few like gyms that I think there's not somebody that at one point has been like, hey, I have an MRI and like what they're telling me is serious, right? Like I'm being told that I need this surgery. Again, he's doing more muscle ups. He's like, yep, it hurts a little bit at night, like I'm gonna get surgery. Dog, you're right handed. It's on your right side. You're not gonna be able to wipe your butt for 6 weeks. Is that the right one? So much. True. So much time, right? Like, we want to address you as a human, not what you're doing. And that's what's so we're gonna bring it back together now that I've worked really hard on that. We're gonna talk about some drills to address each one of these things. So I'm gonna get Shay back up here in front. Alrighty, and we're gonna talk.
Yes.
I am going to. I'm gonna hold your hand. I'm gonna demo it up here. Okay. So we are gonna do this next drill on the rig with a bunch of people. Where would I find a med ball? You don't get. No. So. That's what she said.
I almost said that and then I just laughed instead.
All about how you use med ball, you know? Okay. Sorry. Wow. So, there's a few different ways that folks can tackle this drill. I like it because it is going to help increase that range of motion, and then it's going to allow you to move with some weight through that range that you're gaining, whether it's because like you don't typically have the strength to get there, or it's because we tend to be pretty stiff in that position. So, I'm going to make Shay do this not on the rig, where you guys are up in front, you're going to see this. It's going to be really fun for her. So she's going to hang out in a squat. Theoretically, I'm using one of the thicker bands. Most of us are going to need a little bit more resistance to help increase that extension. This is around her mid-back, right? This is that point at which I want people to be able to kind of bend over that band a little bit. So this is going to be attached to the rig. She's going to drop her butt down into a squat. This is like the highest level of this exercise, right? Like we're chilling in the bottom of a squat. She's going to grab that med ball. She's going to take it across the top of that band. She's going to give it a big bear hug, and she's going to try to drive those elbows up to the ceiling. So she's thinking about leaning back over that band, and then she's going to drop them back forward into that resistance of that band. She's going to come back up. She's going to get that big extension. That elbow to the ceiling position is where we're really working on that strength. She's making this look so easy. I am here to tell you it is not. So what we're going to do is we're going to grab, we'll stick with our partners or the groups that we've been in, we're going to grab a heavy band, we're going to grab a med ball, and we're going to find ourselves some space on the rig, and we're going to work through this. Let's go each partner do 10 reps where we're really trying to drive those elbows up to the ceiling. can do this one with, if you're really, really stiff, you can do it with a, so let's go, I'm gonna go ahead and
Oh, okay.
so we're gonna go, if you're really, really stiff, you can do it with a band like this. You know, this
Oh, yeah.
this is what happens when I don't tell you. If you're really, really stiff, I want a thicker band to pull you aggressively into that external rotation position. So we're gonna anchor it along one rig post. Shay's gonna get on that other side. She's gonna use her opposite hand to help pull the band around. She's scooting bicep back where we're kind of getting that part where meaty part of our shoulder is connecting to that other part of our arm. And she's letting that band pull her into external rotation.
It's really hard.
It is really hard. If you're stiff as hell, I want that heavy band and I want you to really let it crank on you, right? What we're trying to do is really open up that capsule, really, really open up those muscles that are gonna limit that external rotation. If you are someone that has a little bit more mobility and what we really need is like strength in that end range position, we can use a little bit lighter band. This is a good one for like a Shay or I.
The same arm.
Perfect. So she's really working into that external with that band as a block. You can also work this eccentrically by being in that same position that we were in with that heavy band. So go around. No, same one, sorry. Do the same thing that you did for this one. LOL, this is me. Not communicating. No, yeah. So she's gonna let it slowly pull her 1, 2, 3, 4 back into this position, and then she's gonna drive up to neutral. So we're getting that nice slow motion, pulling back. Excellent. She's getting a little stretch through there, and then we're working on strengthening those internal rotations a little bit. So, give these a shot. If you were like, yeah, I had a really stiff shoulder, let's go with that thick band option. If you feel like you need a little bit more strength, I want you to do both of the ones that Shay showed. The one that's pulling you slowly into internal, and you're moving back to external. Definitely not.
I'm just laughing. Try the other one. Nice. He does it.
For the stiff people that like you can go out here, that's the one.
Try that. She has that.
And we're also doing that variation that Shay showed first, where we're getting that active external rotation, right? Now those red bands are kind of aggressive. When I have people do an external rotation to a press, which we're also going to talk about, I'm usually having them use like the skinniest band that's available. So how we anchor the band might have to change depending on what your strength level is. I don't want to do like Shay, crush that. I don't want to do an active external rotation typically across the rig with the red band. That's gonna crush me. So what I might do is hold the band in my hand and I'm dictating how much resistance I'm getting by where that band is placed in my hand from that rotation position. Does that make sense? Excellent. Okay, has everybody had a chance to go through these? Perfect. So we're gonna hit one more here. We've talked about band rotation. So we've talked about strengthening that eccentric position, right? Getting that nice and slow loading on. It's good for pulling you into a more mobile position, right? We're also working strength in that range that we don't typically have. But what about that lat position that we talked about, right? If you were the person who sat on the ground and you went here and you were like, oh no, I can't get very far. What can we do for that, right? So, Shay, I'm gonna steal you for 2 seconds. You were. Yeah. But we're, yeah. So, this is a lat eccentric opener. So what I'm trying to do here for her is provide a little bit of external loading that's going to pull, with gravity's help, right, her into a more overhead position, right? It's going to increase that flexion at the shoulder while she has to control that range down, and then she's got to get a big active press back up. So we're getting lengthening, slow, nice control down. If you're somebody who's stiff, we're getting a little bit more mobility at the bottom. If you're somebody who's really, really mobile, you're having to control that range of motion, and then we're getting an active press back up. So she's gonna be on her back on the bench, just like on the wall. If I can drive a car under her low back, it's probably not doing a whole lot of good, right? The goal of this is to really stretch out those lats. So I wanna put her in a position that's gonna optimally stretch them, right? So we're going from here. You can see when I move her knees up to her chest, it doesn't change a lot on her because she's really mobile. But what we will sometimes see is if I go knees to chest here, that automatically limits the amount of motion that people are getting, right? Because they can't use that low back to the same degree, right? So start with knees up. She's gonna pump back to neutral for me, and then she's gonna get a nice slow 1, 2, 3, 4, 5, 6, because she's so mobile, lower back down. A lot of you are not gonna be able to go this far. I don't need you to go, like, and I've seen this with people too, like, I don't need you to go all the way here if you've got a really mobile shoulder and that feels like crap, right? What that tells me is, where she said word, yeah. What that tells me is, like, we reach a point where we can't control that range of motion anymore. So for somebody who's really stiff, like, you're gonna stop where you start to lose that position, right? You're gonna stop where the body is telling you, like, hey, we don't have any more range, right? You're gonna let it sit there for a second, engineer a little bit more, and you're gonna come back up. If you're somebody who has a really mobile shoulder, like Shay or I, the goal isn't to, like, drop all the way down, right? The goal is to control it down and stop where you start to lose control of that range, right? For me, it's where I'm like, oh, my shoulder could pop out here, right? And that's, I'm sure, what she's feeling too. Yeah. So, different for different people, right? Like, the exercise is the same, but the goal varies a little bit based on your specific presentation, right? So let's go ahead and find a bench, find a partner. Keep your partners honest. Make sure that they're getting those knees up to their chest. Make sure they're keeping that low back flat against the bench. And we're gonna get that slow lower up overhead.
Is that our PVC?
Is this one of them?
Do we want our old?
I didn't want to miss it.
Yeah,
You guys would do something else.